And then after you graduated from undergrad, you became a data manager at the University of Colorado Anschutz Medical Campus. So tell us about that experience and getting into that position.
Yeah, that also feels like a side quest. So that was, I applied for like 50 jobs as I was finishing up undergrad, as many of us do, and this was the one that I actually got. And I didn't really know what to expect. I lived in Arizona at the time and was moving to Colorado. It was a position on I believe, NIH funded project that was through the Indian Health Services that was about education and outreach to tribal communities around heart disease and diabetes. And so I was working on like intaking the data that was being sent to us from all of these different like tribal nations and cleaning through the data and, you know, making sure we got what we needed. Was not probably the best role for me. I am regularly like, I can't believe I didn't get fired. I was probably pretty close. Really cool work, but it was a lot of being in front of a computer and being in an office all the time, which is not me.
And I think that's good to hear from people. I'm glad that you didn't get fired, but considering that you're reflecting, you're like, you know, I was so close to being fired, and like just hearing the trajectory of you coming out of undergrad with a focus kind of like on food systems and food work, and then going into this data role. How did you like pick up the skill sets to do that role? Was it something you picked up on in undergrad or like just through working?
I mean, I think maybe I didn't pick up the skills. That might be why I was so close to getting fired. You know, It was so much of a, you know, when you're like graduating and you're like, I can't find, and everybody around me like can't find jobs, and you're like, let me just get this thing, and hopefully it works. It was, yeah, I think the most I brought to it was an understanding of the interconnectedness of systems and of being in Arizona. There was a lot of focus on indigenous communities and diabetes and like systemic racism. And so I brought that lens into that space. But I think that's probably the extent of my skill set there, because there's a lot of organization, and that was not me.
Understandable. And I believe you were promoted at the same organization into Healthy Kids Colorado Survey Project Coordinator. Can you tell us about that experience?
Yeah, so I actually applied for a different job at the university when I realized this was not meant for me. And so I got this job on a different project in a different department at the university. And that was really cool. I was there for, I think, 3 years. And I was working on, so there's the statewide surveys that are funded by the CDC. And I believe they're called something different other places, because ours is Colorado branded. But it's research of high school and middle school students about health behaviors. And so my job was really helping coordinate the sending out all of these surveys, like thousands of surveys across the entire state, and then getting those surveys back, cleaning the data, getting the data uploaded, getting them scanned. We were using physical paper surveys still.
No.
So kidding. I just like stood by a scanner a lot and then cleaned the data that, you know, inevitably would have mistakes and things. And doing reports. And I got a couple opportunities to be in community, particularly with youth, and talking to them about the survey and like what questions they had and what they want to see. So yeah, I feel like it was a really cool experience.
And how did interacting with the youth kind of inform maybe not the work, but maybe your approach and how you moved forward doing public health work?
Yeah, I think the like disconnect that I heard between what youth were saying and what we were asking, and like there would be things where I'm in person with them and they're bringing up things that are happening, or sometimes they would even write stuff on their surveys. Like it's a multiple choice, right? There was no free writing, but they would write stuff anyway. And it made me realize we do this work sometimes in public health without talking to the people we're trying to help. And when we do that, we aren't actually getting to the root of the problem. We're not actually getting the thing that we want. And so I feel like that helped inform that piece for me.
Yeah, that makes sense. I had a similar experience when I was in Alaska for my community health fellowship and just looking at the big data sets. And then I did a group, like I did focus groups on like photo voice and just seeing how a lot of the themes particularly didn't even have questions that you can really get to what people are trying to say is important to their health. And I think, like to your point, it's so important that we are trying to find ways to co-create these surveys so that we can get to the bottom of the needs and what people are actually saying, and not just like what we think they should be answering questions around specifically. So appreciate that.